Hello and welcome everyone. Thank you so much for joining us today for our webinar on how to utilize a medical translation app to improve patient adherence. My name is Elisa Mutzi and Dr. Linus Kullänger is here with us today as well. Linus, medical doctor and co-founder of Care to Translate, originally created the app to overcome language barriers during his medical internship and now uses it in his practice as a medical doctor. Hi, Linus.
Hi.
Hi. Let's have a quick look at today's agenda. So we will start with a brief introduction of Care to Translate, followed by a short demo of our app. We will then hear from Linus, who will discuss how the translation app helps improve patient adherence. And we will also take questions at the end. So you can write them in our chat throughout the session, and we will make sure to answer them at the end. So what is Care to Translate? Care to Translate is a vast library of pre-translated phrases that are safe to use in a medical context as they have been verified by native speakers with medical expertise. The app currently supports 46 languages and it can be used 24/7 both online and offline. The app can be used on any electronic device and it does not store any patient data. You can use Care to Translate throughout the patient journey, for example, to register patients at reception, to ask patient safety questions, to inform and reassure patients, as well as to provide relevant information at discharge. So that was a short introduction of Care to Translate, and now I will actually show the app so you can see what it looks like and how to use it. So just give me one moment. And in the meantime, again, if you have any questions, please feel free to write them in the chat and we will answer them afterwards. So this is our Care to Translate app, and you can see the blue icons up here. These are playlists, which are like dialogues that you would have with patients in different contexts. So you can have one playlist for each specific situation across the patient journey where you need to inform, instruct, or ask questions to the patients. You can see here that I've selected a language, the Norwegian language, as the patient language, but you can switch between different languages at any time. I will now go into the pain playlist. So I click on the playlist and you can see that there is a list of phrases that appear in a certain order. This order, of course, can be revised and changed. You can add more phrases or remove phrases from the playlist. Now, to translate, you click on a phrase.
Har du vondt?
Are you in pain? And you can see that the translation plays both in audio and text formats in the patient language. So now this is a question and you can either instruct the patient to please nod for yes or shake your head for no so that they know how to reply with body language. Alternatively, they can also choose between one of the built-in answers in our app. So these are a few more examples of phrases you can say. So for example, where does it hurt?
Hvor har du vondt?
Please show me where.
Vis meg hvor.
So the patient can show you. You can also ask on a scale from 0 to 10, how much does it hurt?
På en skala fra 0 til 10, hvor 0 ingen smerte I det hele tatt, og 10 den verste mulige smerten, hvor mye gjør det vondt? Vis nummeret med fingrene.
So you can ask the patient to show you a number with your fingers. And you can also see that some of our phrases are accompanied by an image icon. And you can press on it and an image will show to further convey the meaning of the phrase you're trying to communicate. You can ask how many hours have you been in pain?
Hvor mange timer har du hatt vondt?
And again, show the number with your fingers. If at any point you realize that you want to ask a question that's not in the playlist, you can search for a keyword, for example, pain medication, and you can find the phrase you're looking for. Have you taken any pain medication?
Har du tatt smertestillende legemidler?
And later on, you can add that to your playlist if you would like. You can switch patient language at any point. I will now switch to French, for example. And whenever you choose a gendered language, you will need to select whether the patient is addressed as male or female. I will choose female for now. And I will show you a different playlist. I will go into the Reassure Patient playlist. You can see here that this is another set of phrases that we have in this particular playlist, and you can ask the patient, do you feel all right?
Est-ce que vous vous sentez bien?
You can ask them, are you currently feeling this way?
Vous sentez-vous ainsi en ce moment?
And you can see that there's a list of phrases where you can ask the patient if they're feeling afraid, worried, stressed, if they're feeling anxiety, or if they're feeling lonely. You can let them know that you understand that they're not feeling well and you understand that they're worried.
Je comprends que vous êtes inquiète.
And you can reassure them, don't worry, please don't be afraid, we will help you.
Nous allons vous aider.
So that the patient knows that you are there for them and you can calm them down. You can also ask them if they would like you to call anyone.
Souhaitez-vous que nous appelions quelqu'un?
And again, you can show an image to further convey the meaning of what you're trying to communicate. You can let them know that you have informed their relatives that they are fine.
Nous avons informé vos proches que vous allez bien.
And they will come to
Vos
visit.
proches viendront vous rendre visite plus tard.
So that was a short demo of the app. And now it is time for Linus to tell us more about the app and how it can be used to improve patient adherence. So I will just share my slides again. And again, if you have any questions for me or for Linus, just write them in the chat at any point. So I'll pass it on to Linus.
Yeah, so hi, thank you for having me here, and it's so nice to have some people to watch this. So my name is Linus Kullänger. I am one of the founders of Capio Translate, and I'm also a medical doctor. Currently, I'm working working in palliative care and also in advanced home care, where I work with both the patient with curative diseases, or they can have a different infections that need IV fluid, but I'm also working with mostly with people with palliative care needs. And I also work as a teacher in the medical program at the Karolinska Institute in about 20% of my time. So that's about it. So why am I talking about this? So this is I started Capio Translate, but why I started Capio Translate, one of the or why we started Capio Translate, one of the reasons were the patient adherence and why that's so important. So today I'm going to talk about. It's not going to be a long presentation, quite short, but hopefully you will get something from it. First of all, the importance of patient adherence. I'll talk about the essentials for patient adherence, what we need to get patient adherence to work, how to improve patient adherence when we have language as a barrier, and then examples of how you can use Capio Translate in palliative care. But first of all, I will start with talking about why is patient adherence so important. And just to clarify, saying patient adherence, that's usually now what the words we use for meaning like patient compliance or medical compliance or medical adherence. It's different. It's the same meaning for it, but patient adherence. Why is it so important? I would say that it's like the basis, or like the most essential thing we need as medical personnel when we treat patients. Because we can prescribe whatever medicine or whatever treatment, but if the patient is not going to follow the treatment, then it doesn't make anything make any sense of what we do. But for example, like why it's important is, like, of course you need patient adherence to maximize the treatment's effectiveness, preventing different complications, You need to improve patient safety and enhancing, of course, the quality of life. And if you're in a broader spectrum, you also needed to reduce healthcare costs, support public health goals, and also to build the trust in healthcare. That's like the ground, but of course it's a broad thing. But I mean everything from just like getting the patients to take the medicine or get the treatment, but also to like reduce costs in society. So we can do the next slide, Elisa. So what is essential for patient adherence? Here we can take the next slide immediately. This is, I mean, you can have different examples of this, but I made a list of few examples of what's essential for patient adherence. And this is just some of them, but first of all, to get good patient adherence, you need patient-centered communication. The patient needs to understand the treatment that they are given. They need to understand why the treatment they're given, why they're taking it. So like, let's say you have a medicine that has a lot of side effects. People are not prone to take medicines with side effects if they don't have understanding of why they're taking it. If it's very important, then they need to understand it. They also need to understand, they also need to have clear instruction on how to take it. For example, if you have an inhalation or something like that, they have to know how to use it. I come across a lot of elderly people with very much diseases in the lungs, and they have problem to take the medicine because they don't really know how to inhale the medicine. But also one of the most important thing in patient-centered communication, we have to have the shared decision making. The patient needs to be involved in making the decision of what medicine they want to take or what treatment they want to take. Otherwise, if we just decide it, then they're probably not going to be prone to take the medicine as much as we want. And number two, education and awareness. Like, you have to tailor the information so they can understand what they're going to take. So you have to know like what type of health literacy they have, or like if they're old or if they have another language, for example. But you also need to follow up, because sometimes you give the information to the patients and then you leave the room, and then like after a month you talk to them again, and then you realize that they haven't done what we thought they were going to do. Then number three, simplified treatment regimens. That's a lot of things we work with in palliative care, like reduce the complexity, not have too many drugs, try to minimize it and try to make it easy for the patients. Then number four is behavioral support. You can have reminders, different tools to make the patient take the medicine, like you have different apps for that example. And then, of course, different motivational techniques. Let's say you want a patient to quit smoking. You have different techniques to talk to that patient to get them to not smoke in the future. The fifth is a strong patient-provider relationship. You have to make them trust you. You have to show that you are empathetic and that you care for them. And I would say that now we have this on number 5, but this is one of the most important things, because if you don't have the trust, like if they don't feel trust for you as a medical professional, they won't listen to you. They won't take your advice as seriously as you want. The sixth one, you have to address barriers. This is, of course, very different because depending on where you work in the world, if you have universal healthcare or not, but you have to maybe think about their financial situation, their access to medicine, everything from like pharmacy or how they can take the medicine, if they can get it for free, or if they can go like walk for themselves to the pharmacy to get the medicine. You also have to see what I talked about before, the side effects management. You have to follow up and see if they have side effects, what they think about that, and how you can, I don't know, adjust the medication, or if you can change something for them to continue to take it. And that's and then also the monitoring feedback number 7, that you do, it's important that you do regular check-ins on the patients to follow up and see that, and also try to give some positive reinforcement, like, okay, now we see some progress because you are doing this, then we see that everything is going forward as a plan. For example, this could be not only that you're taking a medicine, but for example, in obstetrics, if a woman is giving birth, that you give them positive reinforcement that, like, okay, now we see the head, like it's coming out, the baby is coming out, and that is important. Maria, jag kommer tillbaka. Sorry. Förlåt. Okay. Sorry, I'm still at work, so I'm still on the clock. So one of the doctors had a question for me, but that's also one kind of positive reinforcement. Another thing is, of course, cultural competence, that you understand the different culture, you have some kind of understanding of different types of cultural backgrounds for the patient and yourself. And what we're going to talk about later, language support. And then also, of course, lastly, support systems. They have to engage family or community or friends, so the patients can get help or support to take their medicine or follow up their treatment. Also, like peer support groups as well, so they can handle. So next slide. So what happens to patients and adherence when you encounter language barriers? And now we see a slide where I crossed almost everything, because like if you can't communicate with the patient, it's extremely difficult for you as a medical professional to get the patient or to enable all these essentials, like to have a patient-centered communication. If you can't talk to them in the same language, you can't educate them in the same way. You don't have the behavioral support in the same way with motivational techniques. It's very difficult to build trust, to show empathy in the same way. Of course, you can do it in some ways, but not at all in the same way. But of course, I've kept one there. It's a simplified treatment regimens. Of course, you can reduce complexity, so you can do something, but it's very difficult to work with patients if you can't speak the same language. So that's like, I mean, we will get back to that, but that's one of the most important. That's why we started the Capio Translate, because we need to be able to talk to patients, to be able to build a relationship with them, and just to educate, in every way you can with patients. So if you go to the next slide. So what do I use, or what do we use, like here at the palliative medicine? Usually, like, because Capio Translate is, I use it a lot. Of course, it's one of the tools that I use the most, but I usually use a combination of tools when approaching patients. And this is just an example from palliative care and specialized care at home. But of course, this is probably the same wherever you work. But for example, we use Capio Translate like for checking in all, like 24/7, all symptoms. If you are in the palliative care unit where we have the patients 24/7, we are able to like do all the symptom screenings, which are extremely important. For example, like looking for nausea, pain, like how is the pain changing? Like do we have any effects of the pain relief and so on? We can give them medical instructions, like how do they take their medicine, or how they educate them in different ways, so how to use the medical devices, for example. We also can, like 24/7, give them the continuous like information of, for example, how is it going, like where, like, or do you have any, like, what are we doing with the treatment, like what is happening right now, because that's one of the things that a lot of patients feel worried about, like what is happening right now. And of course we can give positive reinforcement, but also, like Elisa told about before, that we can give, like, maybe calm them in some way. We can just be there as humans. And if Character Translate is really good for this because you can, I mean, it's so easy just to like pick it up and then just ask a few questions or just give some information to the patient right on. You don't have to call somebody. And also, like if they're in the hospital, usually, I mean, they're there 24/7, so their relatives can't be there in the 24/7. And you can't always depend on the relatives as well. The patient needs some autonomy as well. So it's really important to use that. And then and also I want to add something there as well, because everything is medical verified. It's really good, for example, to evaluate symptoms with it, because it really describes the symptoms in the right way, in a medical verified ways that we can trust when we prescribe new medicine or something like that. But of course, we use a combination of tools. So, for example, live interpreter is of course very important to use, especially for in-depth conversations. Like I did just an hour before this one, I had a meeting about the transition of care discussion. A patient who had the oncological treatment before, but now is going to have for palliative medicine, and that kind of situations open up for so many questions, and it's really important to try to get them to be able to ask all the questions, and you try to have all the nuances of the language there. But when you use a live interpreter, mostly in our case, it's the medical doctors to use it, because we are the ones that have the long conversations with the patients. But one thing is very important when we use live interpreters is that you, in the end, always ask the patient for a summary, because like for example, in Sweden, there's so few interpreters that are medical trained. Most of them, like maybe I can't remember the percentage, but it's just like, for example, in Arabic, it's maybe 20 interpreters in all of Sweden that are medical trained, and there are thousands of interpreters that their background is quite different. So you can't really, like, they could be good interpreters, but sometimes they miss. They don't know the word for different, or the meaning for different words. So you need to make sure that the patient understands what you said. So ask for the patient for a summary. And one thing we also use a lot, which I actually handed out one this morning, is translated booklets or leaflets or PDFs for in-depth standard medical information. For example, we give one to all patients that are dying. We give a booklet in the end, or like when they're coming close to dying. We give it to the close relatives. We give a booklet that they can read about what's happening to the person. And now I handed out one in another language, so they can read about it in their own language. For example, this one is an example. We have translated one for a non-profit organization called Betania Stiftelsen, which the name is to you as a close relative. So if you work in palliative medicine, or listening to this, or if you work at palliative home care, this is free to download, this brochure or this booklet to you as a close relative. Today som närstående is the name in Swedish. It's really good to hand out in different languages. So we can take the next slide. So I'm just going to put up some examples of situations where I use Character Translate in palliative care. I already talked about this, or I mentioned it, but nurses and assistant nurses usually use the app for screening for symptoms. And as Lisa showed a bit, like you can screen for like symptoms of pain, like the location of pain, the characteristics of the pain, but also the effect of course, like you get to know like the effect of the pain relief treatment that you're giving, which is of course very important, especially where in in the specialty we work in, like where we use a lot of pain relief treatments, and we want to know the effects of it, so we can either continue with it, increase it, or just not use it anymore. Because we also want to know the side effects, of course. And this is something we want to do like continuously, regularly, and the app is really good for that. And this is just one example. The other ones is we can give instructions for example, in advanced home care patients on how to use like patient-controlled analgesia pumps, like pain pumps. You can when they can press themselves to get the pain relief. We can also help them instruct them to connect or disconnect the IV fluids or manage other types of medications, which is to get them to be more autonomous as persons, which is of course very, everybody benefits from that. And lastly, one thing I think is actually the most important thing with the app, or with everything concerning language barriers, enhancing the patient-provider relationship by going the extra mile to build trust. And that is you can do all of the other stuff. It's very important, and it gives a lot to the patient adherence. But just talking to the patient, presenting yourself, introducing yourself as, for example, when I have an Arabic patient, doesn't speak Swedish, and then I can go in and say marhaba, ismi Linus, my name is Linus, Ana Tabib, and then they usually sign up, because they're not used to a person, a doctor, talking their own language. And this is just three phrases. I'm terrible in language, so you can hear my English is not so good either, but that makes a lot, and it builds trust. So if that's the introduction between me and my patient, then it's so much easier for all of the other stuff in the essential lists for patient adherence to just go well. So that's and that's what one of the things actually I use the app for, is sometimes I just practice myself to say some of the phrases, just to, especially the ones that are hello, how are you, and then who I am, and stuff like that. Yes, next slide. So, and that was what I wanted to say as the last thing. We always have to remember, for us, it's we work, we want the patient to go somewhere. We want to give them treatments in different ways. So we give them, and we want to do a lot of stuff with the patients, but we also need to understand that sometimes we forget to include the patients in the journey, and that is one of the most important things. We are here for the patients, and we should never forget that. That's the work we do. Otherwise we are not needed. So yeah, thank you for me. That's the last thing I wanted to say for questions.
Thank you so much. Thank you so much, Linus. That was a very compelling topic, and it was beautifully explained. So thank you so much. Unfortunately, we won't have time for questions today, but please reach out to us if you have any questions, and we would be happy to help. So just contact us, and we would be happy to answer any questions. If you would like to have a more in-depth walk through the app, or if you'd like to learn how you could implement the app in your hospital department or healthcare clinic, please get in touch, and we will help you with a demo. If you have any questions specific to patient adherence, you can contact Linus, and otherwise we hope that you've enjoyed our webinar. Thank you so much again, Linus, for being with us today, and for your beautiful lecture, and hoping to hear from our attendees today. Thank you so much.
Thank you. Okay.